Roxanne Stein.
Atrial fibrillation can pose a very serious health problem. Treating it is taking a big step forward with a new procedure. And Dr. James Morris of Boca Raton Regional Hospital is here to talk about the Atria Clip. Nice to see you again. Thank you for joining us this afternoon. First of all, why is atrial fibrillation, why does it pose such a health risk?
Atrial fibrillation is actually one of the most common heart rhythm problems. It affects about 5 million people in the United States and is one of the most common causes of stroke. Atrial fibrillation is the cause of actually about 20% of strokes that occur.
What are the conventional ways of treating it?
One of the principal treatments is directed towards prevention of the blood clot formation that forms inside a portion of the heart, the atrial appendage. These clots can break off, causing a blockage in a blood vessel to the brain, and that's what causes a stroke. So the treatment is directed towards the use of very potent blood thinning medications.
Which have their own set of risks, don't they?
That's correct, that's right.
So what is the Atria Clip?
The Atria Clip is actually a minimally invasive operation through a small keyhole incision where a soft clip is applied around the appendage to exclude it from the circulation, thereby preventing blood clots from breaking off and causing a stroke, and preventing the requirement for taking blood thinning medications.
Who's eligible for this?
This principally would be indicated in individuals that are at high risk of having a stroke and have reasons either why they will not or cannot take the blood thinning medications.
What are the risks associated with the Atria Clip?
This is a relatively small operation in regard to conventional heart surgery. The risks are not zero, but relatively small, and certainly are less than the risk of the potential complications of having a stroke without the treatment.
And are there fewer risks associated with taking the strong blood thinners?
That is believed to be the case, that's right. Although the blood thinning medication Coumadin can be effective at reducing the stroke risk, there are bleeding complications with that medication.
But we need to be clear, you can still have a stroke without having atrial fibrillation, just to get this out there.
That's correct. The other common causes of stroke are high blood pressure, as well as blockages in the blood vessels that supply the brain. And this treatment would not be indicated for those sorts of problems.
How new is the Atria Clip?
This was approved by the FDA within the past month, and really have thus far just been a handful of procedures done in the world. But this is believed to be a very effective and perhaps widespread treatment.
And a big step forward, I presume, in treating atrial fibrillation.
This could be an extremely large step forward, that's correct.
Dr. James Morris, thank you for your time today. We appreciate your joining us with such great information about treating atrial fibrillation. Dr. James Morris is provided by Boca Raton Regional Hospital, which also sponsors our Ask the Doctor segment. We're back with more in just a moment.